Hello. All right. Okay. Popping on here live. Just want to make sure we have a good video form. All right. Testing for pelvic instability. So I was just trying to meditate and I just kind of let my body do the next thing that came to me. And that consisted of doing a quad set. So in physical therapy, a quad set is something that you do to help strengthen your quads. And I'm going to show that to you by using a bolster. You can use pillows, rolled up towels, but something that gives you some elevation to go underneath your knees. So here we go. All right. Laying on your back and find a comfortable position where your legs are resting and you're over a bolster or something like this, so it's just below the knees. All right, so I want you to have your hands on your hip bones. So just assess here first. I want you to just put your fingertips on your hips, and then if you can, just glance up to see, is one hip lower than the other? And just make an observation for that. For me, I have a rotation of my pelvis to the right. However, I do see a very, very small dip of the right, but it's much more level because I've been really working on pelvic stability here. Okay, so keeping your hands on your hip bones, you're going to slide the fingertips just 1 inch inside. You're in the vicinity of your transverse abdominis as it feeds into its attachment at your pelvis. It also feeds into your attachment at your rib cage here too. What I want you to do first is take your right leg, keep your knee on the foam, and you're just going to slowly bring your foot up. Flex your foot as much as you can, and I want you just to notice if you felt a shifting, a shearing, a dipping of your pelvis. And then you can tilt up to take a quick look. Bring your heel back down to tap and rest on the table. Trying the left side. Just feeling. Letting your mind focus, slowly contract your quads, lift your leg up to straighten it, then flex your foot as much as you can. Did you find any shifting of your pelvis underneath your fingers? Slowly bring that foot back down, back to the right side. Contract your quad, lift it up, and then flex your foot. It definitely dipped down on my right side. So what I'm going to do is just adjust my pelvis ever so slightly so I'm level. Bring that heel back down. Okay, left side, lifting up, flexing your foot. Now I also felt a slight dip, but it was more internal on this side. And what I feel is actually that my left glute is not as developed as my right glute. And so it dips down because it's softer and squishier here than on my right side. There's less bulk. So a lot of times when you look at your pelvis and to see if it's unstable, it might not just be because something is off or you have an anterior posterior tilt or rotation or anything like that. It could also be that you have one tush that's not as developed as the other. So here I'm going to do this left side again and double check I'm level here. All right, I'm going to give my left foot a little extra squeeze as I bring my foot up. And now I'm still level. Slowly bring it back down. All right, let's do 4 more total. Now, as you do these next 4, I want you to try to maintain level hips as much as you can. You can engage your transverse, your deep corset type core muscle. Lifting the leg up, make your adjustments. Flex your foot, always follow through with the flexed foot. Let the heel come back down. Other side comes up. Good, and then slow on the way down. 1 more on each side. Flex. Good. As you're doing this, your brain is figuring out what you want it to do and making those adjustments. Good, adjusting slightly. Flex as much as you can, and bring it back down. Good, all right, to come back up, roll to your side, and then push yourself back up. Okay, so there you go. That's just a quick way that you can do a quick check to see about how your pelvis is stabilizing you. If you lift one leg and there's a dip, if you lift one leg and there's a shift, any of these things really can play a role into how you are stabilizing as you're walking, as you're doing just everyday activities. One trick that I use is really using my transverse abdominis as a way to support my spine as it relates to the pelvis. So the transverse starts here in your back and it wraps around like a corset and it attaches at the pelvis and along the ridge of your rib cage, intertwined kind of within the vicinity of your diaphragm. So it's really an important core stabilizer. So if you have low back instability, pelvic instability, try to engage the transverse as an internal corset as you're doing any of the activities that you love to do. In my YouTube, somewhere in the stream of videos, I do a video on educating how to find your transverse. So I encourage you to go back, see if you can find that. If you can't, just let me know. But I've been teaching the transverse for like many, many years, back when I worked at the hospital in New York, and I call it the magic muscle because it really can do incredible things. So let me know if you had any interesting discoveries and if you had some instability within your pelvis. I'd love to hear it. Thank you so much. Bye-bye.